Good day, everybody. We are welcome to this webinar, the latest of the FIP digital events, Pharmacists Advancing Pharmaceutical Care Across Africa. And the topic of today's presentation is the role of pharmacists in preventing influenza and increasing vaccination coverage rates. We are all welcome. Right now, we have about 94 people on the call. We're all welcome from all over the country to this very interesting webinar. Next slide. I'm Dr. Ariola Joda from Nigeria. I'm currently the Assistant Secretary and Editor-in-Chief of the African Pharmaceutical Forum, the 5th Regional Forum of FIP, and I'll be moderating this event on behalf of the FIP digital events. In our announcements, let me just quickly inform that French-speaking participants, we have a French channel for you to listen to. So just click on the FRE icon to take you to the French channel so that you can enjoy the webinar even better. It's being recorded and live streamed via YouTube. And of course, we have both English and French on. The recording will be available on the website after the event at www.events.fip.org. And you may please use the chat, the question and answer box for your questions. We will unfortunately not be able to take questions at the end of the event verbally, but drop your questions as you have them in the Q&A box, and then they will be answered from there. You're welcome to provide feedback on webinars at fip.org, and of course, you're welcome if you're not yet a member of FIP to join FIP at FIP membership registration. Next slide. So we're quickly running through the events for this morning. After this introduction, Professor Cheryl will take on the overview of the topic, and then we'll do a quick poll. Then we have 4 speakers that will look at the topic from different country perspectives. After Mr. Gonzalo Pinto has talked about the role of pharmacists in increasing influenza vaccination coverage, we'll ensure that all questions dropped in the Q&A box are attended to, and then we will be closed. So after this introduction, I would like to thank very specially on behalf of FIP Digital Events, Sanofi for supporting this online event. And there will be further events focused on Africa in the series that would also be supported by Sanofi. This event actually was based on poll results from a previous event supported by Sanofi on the role of pharmacists in diabetes prevention, screening, and management, which held in June. And from that poll, the questions showed that people were interested in topics around vaccination, cardiometabolic diseases, infectious disease, and neglected tropical diseases. So we are very, very welcome to this outcome of that last poll. So quickly now, next slide. The learning objectives for this webinar are to improve our knowledge on the risk of influenza, explore pharmacists' roles in influenza prevention through vaccination and increasing influenza vaccination coverage rates within the African region, and then showcase country cases from pharmacists across the continent on influenza vaccination, digital vaccination solutions, and patient communication on vaccines. I can assure you that you are here for a time of learning. In fact, for the time that I've had to deal with this webinar, I've realized that there's more influenza in Africa than I previously thought. Next slide, please. So we're going to move on quickly to our first speaker, Professor Cheryl Cohen, and she will be talking on an overview of the risk of influenza and influenza vaccination in the African context. Professor Cohen is the head Center for Respiratory Disease and Meningitis, the National Institute for Communicable Disease. She's a professor in the School of Public Health, University of Witwatersrand in Johannesburg, South Africa. Over to you, ma'am, for your presentation. Please unmute yourself and go ahead. Thank you.
So thank you very much for that kind introduction. Can I just check, can everyone see me and hear me?
Yes, you're good to go, ma'am.
Thanks so much. I'm delighted to be here, and thank you for the invitation to this meeting. And I was reflecting as I prepared for this presentation that I've been working on influenza for almost 20 20 years. Of course, last 2 years have been a bit more COVID than flu, but it's nice to be back talking about influenza again. And over those 20 years, I think the understanding of the role of influenza in Africa has really changed. So if you can show the next slide, please. Just as a bit of background, I think many people may be familiar with this. Influenza is caused by a virus, and it's one of the first viruses ever identified, first isolated in 1933. And what's very unique about it is that it's what we call a segmented RNA virus. That means the genetic material is in 8 different segments. And because it's in different segments, it means the virus can easily exchange 1 or 2 segments with other viruses. And this in part contributes to the fact that influenza can evolve so rapidly. It's also an RNA virus, and that means many RNA viruses, when they replicate themselves, they copy their genetic material to make more viruses. That's quite an error-prone process. And that can also be another reason why, amongst all the viruses we know, flu is one of the viruses that mutates the most of all of them. And because of this frequent mutation, we do see annual seasonal epidemics of flu. Flu isn't one of those diseases you get once in your life, but it's a disease that actually we're infected with every few years. And part of this is because the virus is always evolving to escape our immune response. There are 3 types of flu viruses, influenza A, B, and C. In humans, it's just the influenza A and B that are important. And the A has 2 kinds, H1N1 and H3N2. The important thing to note is that, as I've mentioned, flu is a rapidly evolving and mutating virus. And there are 2 different processes by which it evolves. One of them is called antigenic shift, which is the change from one year to the next, the fact that the flu strains are changing every year. Sorry, that's antigenic drift, sorry. An antigenic shift is a much bigger change where you actually have a completely new flu virus with a different surface structure, those hemagglutinin and neuraminidase that are the important surface structures for immunity, and that can actually give rise to a pandemic. Now, because flu is mutating all the time, the vaccine actually has to be updated annually. And we'll talk about that a bit later, but that's quite a unique feature of the flu vaccine, that it's not the exact same vaccine we give every time we give it. Next slide, please. So I'm not going to talk to all the detail in this slide, but this is just to highlight or elaborate a little bit on the fact that influenza can actually cause pandemics. And this is because, as you see on this picture, there are lots of different kinds of influenza that can occur in animals. I mentioned in humans, we have the H1N1 and the H3N2, which is based on the hemagglutinin, the H, and the neuraminidase, the N, surface structures of the virus, which is what we have immunity to. But on this picture, you can see there are lots of other H's and N's, and they're in lots of different animals. And what can happen really is that one of these surface structures from an animal actually gets translated into a human virus, creating a new virus to which there's no immunity, and this could cause a pandemic. And we've just all come out of the COVID pandemic, so I think everybody's familiar with the fact that this is something we do need to be concerned about and prepare for. With regard to flu, the most recent pandemic was the 2009 pandemic, and that was actually a relatively mild pandemic. But of course, we need to be aware that a future pandemic might not be that mild. Next slide, please. But moving away from pandemic influenza, and I see the circles have shifted a bit on the slide, but even more important than the possible pandemic is actually the annual burden of severe influenza every year in terms of morbidity and mortality. And this paper was a very influential paper published in 2017 in the Lancet, where they really tried to estimate the total burden of mortality, respiratory mortality due to influenza globally. And you can see in the figure, the darker the color is the higher the mortality burden. And the most striking thing on that graph, and the red circle should really be around Africa, is that by far the highest mortality burden in every age group is in fact in the African continent. And I think this is something that really wasn't known. When I started working on flu in the early 2000s, this wasn't known. It was really, work from a number of people in many countries in Africa that has now demonstrated that in Africa, flu was often missed because of malaria and other diseases that can look like flu. And that when we started systematically studying flu, we found that there really is a very, very high burden of influenza, the highest in the world in Africa. Next slide, please. And this is really contrasted to the data. This slide is a bit old, but it hasn't changed at all in more recent studies, that if you look at the use of influenza vaccine throughout the world in the different regions, you can clearly see Africa is that little orange sliver at the top of the pillar. The influenza vaccine use is by far the lowest in the WHO Afro region. So we have this major disconnect between the highest burden of mortality and severe disease being in Africa, but the lowest vaccine use also being in Africa. And there are many reasons for this. I think one of them is that the burden is underestimated because of the non-specific clinical presentation. Also, African countries have lots of other competing priorities, malaria, HIV and AIDS, tuberculosis, and then the general perception that influenza isn't thought of as being a severe disease. Next slide, please. Now, when we think about influenza vaccination, one of the things that complicates it is that influenza often has a seasonal vaccination strategy. So this is a slide from South Africa, which is right at the southern end of Africa. And in South Africa, which is a temperate country, influenza is highly seasonal. Flu circulates in the winter, and we vaccinate with the Southern Hemisphere influenza vaccine strain every year before the winter season. If you can move to the next slide, please. This situation, however, is complicated in more tropical countries. And you can see on this map the sort of pinker, purpler colors. Those are the tropical countries that have multiple influenza seasons. And that really makes up many of the countries in Africa. In those countries, it can be a more complicated decision. If you have 2 influenza seasons, then you have to make a decision. When is the best time to vaccinate, and which vaccine formulation should we use? Do you use the Southern Hemisphere formulation, and do you use the Northern Hemisphere formulation? And I think this is a real difficulty in many countries. I don't have time to really discuss it. For every country, the decision is different. And it's one of the reasons why it's very important for countries to actually have surveillance in their country to know what is the timing of the influenza season, which strains are circulating, and are they more similar to the Northern or the Southern Hemisphere. Next slide, please. Now, just a little bit on the clinical presentation of influenza. I think the important thing to highlight is that, firstly, influenza has a non-specific clinical presentation. You can't tell by looking at the patient without doing a test whether they have influenza or another respiratory virus. The other very important thing is that there's a very wide range of severity. So similar to COVID and many other respiratory viruses, you can have influenza and actually have no symptoms at all. You can have a very mild illness, but influenza can also cause very severe disease and hospitalization and mortality. In the typical mild case, the incubation period is very short, 1 to 3 days, and this classic sudden onset of fever, cough, headache, sore throat, runny nose, and often body pains, a more systemic picture is typical, in contrast to some of the other cold and flu viruses. The typical disease is lasting 3 to 5 days. It can affect the abdomen, especially in children, but the signs and symptoms vary with age and underlying illness. Next slide, please. And importantly, that influenza has many complications. And so particularly in people with underlying illness, it can cause exacerbations of chronic conditions. And this can cause a lot of, in fact, severe hospitalizations and mortality that might not be typical flu. They may not even look respiratory. It might be a heart attack or an admission for COPD, but the influenza really set off that cascade that led to the admission or even the death. It can cause a viral pneumonia, so an actual viral infection of the lung. And influenza is a very well-known predecessor for bacterial pneumonia. So if you have flu, this can make you much more susceptible for the bacteria then to go on and cause a severe bacterial pneumonia. And then on the right-hand side, you see this long list of other complications: myocarditis, pericarditis, croup, bronchiolitis, rhabdomyolysis, encephalopathy. Really, influenza can affect any organ system, and it causes an itis, an inflammation, and some of these complications can be very severe and even lead to death, for example, myocarditis or encephalitis. These complications are less common, but they do occur, and they can cause severe illness. And the important thing to highlight is that while most cases of flu are mild, influenza is very common. In our studies in South Africa, we have shown that 1 in 3 people catch flu every year. Now, half of those people may be asymptomatic, But you can imagine with all those millions of cases, even if 1% or 0.1% get severe disease, that's how it translates into this very high burden of hospitalizations and mortality, which is often unrecognized because of the non-specific clinical presentation. Next slide, please. So the important thing to note is that not everyone is at the same risk of severe influenza. The key risk groups are age, so older adults, people over the age of 60 or 65, and young children under 5, and particularly those under 2, have a very high risk. Pregnant women have a high risk of severe disease, and then obesity, long-term aspirin therapy, and then very importantly, your underlying conditions, heart disease, lung disease, liver disease, important immunosuppression, including HIV. All of these groups are at higher risk of going on to those severe complications and not staying with mild disease. Next slide, please. And if we can move to the slide. Based on this, the World Health Organization recently updated their position paper on vaccines against influenza. It was updated just this year, and I was on the committee for the WHO group that actually developed these recommendations. And I think what's important is firstly to understand a bit about the rationale about who is recommended to get vaccination. Firstly, to see at the top that WHO recommends all countries should consider to implement seasonal influenza immunization. And the groups that should be targeted, it should be primarily to protect high-risk groups against severe disease. And then if you look at the end, there's a second reason why we might vaccinate, and that's to safeguard the health systems and reduce transmission. And based on that framework, if you look on the right, you can see the target groups that WHO, just to the previous slide, recommends to be vaccinated. So you have healthcare workers there. Now, healthcare workers don't have a higher risk of severe disease, but they have a risk of acquiring influenza in the workplace, and also they can spread it to patients. And then you see the other groups are really your risk groups, your people with comorbidities and underlying illnesses, your older adults, your pregnant women, and children may be vaccinated, although WHO says this is optional, whereas before they were a recommended group. Next slide, please. Now, I just wanted to talk a little bit about the vaccine formulation process, because I think this is really one of the great public health achievements. Because flu is changing all the time, we need to have a system to monitor how the virus changes and to make decisions about what goes into the vaccine. Because as I've said, flu vaccine is quite unique in that we actually use a different product every year, in that the viruses in the vaccine are changed every year. And then there's a whole special regulatory mechanism to make sure that when the viruses are licensed in a country, they're licensed, the actual product is licensed, but actually what's in the vaccine can be different each year. So there's a global network of laboratories, you can see them on the map, that do surveillance for flu. And every year there are 2 meetings that are held. In February, there's a meeting to decide what will be in the Northern Hemisphere vaccine. In September, to decide what will be in the Southern Hemisphere vaccine. And they take all the data from all these laboratories throughout the world, look at what strains are circulating, and then decide what they think will come the next year and put it in the vaccine. Next slide, please. And this slide I'll go through quickly. I just wanted to highlight that the process of making a flu vaccine has multiple stages. You can see lots of steps, and it takes time. And so from strain selection to releasing the vaccine is really a minimum of 6 months, sometimes a bit longer. And so it's really critical that the decision be made and that everything goes smoothly in production, that the vaccine can be available in time for the next season in the Northern or Southern Hemisphere. And again, just to go back, that in tropical countries, it is more complex. You do need to decide when do you want to vaccinate based on availability of the vaccines. They're only available for a short period, Northern and Southern Hemisphere, and also based on when you see the most flu in your country. Next slide, please. And just to highlight also this global inequity in terms of influenza vaccine manufacturing capacity. This is an old slide, but up until the COVID pandemic, it really hadn't changed much, where you can see that the most manufacturing is really in the Northern Hemisphere, wealthy countries of the world, and there's very little manufacturing on the African continent. And of course, this represents a substantial risk if there is a pandemic, because what we saw with COVID is that even despite all the best international efforts, Africa was really the last to get access to vaccines. And so I think this map is changing. I haven't got an updated map, but I think there's been a lot of recognition following COVID that we have to build manufacturing capacity in the continent. But I think just to make the point that this is really a critical need, because by far the most likely candidate for the next pandemic is in fact influenza. Next slide, please. And this is my last slide, just to show what happened in the 2009 pandemic with influenza A vaccine distribution. You can see that Africa did get a lot of donated vaccines, and in the end, we did vaccinate a lot of people, but the vaccines actually came after the pandemic. So because we were relying on donations, there was a delay. And of course, this is what we want to avoid in the next pandemic. So in summary, influenza produces a substantial global morbidity and mortality, and the burden is highest by far in Africa. But the vaccine uptake is lowest in the African region, and this is exacerbated by the fact we do not have production on the continent. Flu represents a real pandemic threat, and every country in Africa needs to increase the use of influenza vaccination for seasonal influenza, because that's the best way to protect your country, by having a sustained supply in the event of a pandemic. Thank you.
Thank you so very much, Professor Cohen, for your presentation. An eye-opener, if you ask me, on the impact and the far-reaching prevalence of influenza in Africa. Thank you very much for your presentation. We'll be going right along, and I believe we have a poll right now. So we have a first poll, so I hope we're all ready to vote. We have 45 seconds for each question, whether you're on the French or the English channel. So the first question is up. Influenza is a serious health risk that can cause complications that lead to hospitalization. You are to submit your response, and then we would see. So this poll is just the optional questions measuring our awareness on the risk of flu and preventive action. So it's not something that the responses cannot be used against us. Let me put it that way. So you cannot be identified by FIP, and it will not be shared. So if we're done with that. And we have the results. The results are up. Influenza, so 57% strongly agree, 37% agree, 4% neither agree nor disagree, 2% disagreed. The answer, of course, is strongly agree, listening to Professor Cohen, even though many people are asymptomatic, but there's still that risk of serious complications, including encephalitis and myocarditis that she shared, that could lead to organ damage and death. The next question. Influenza can trigger acute myocardial infarction, stroke, cause exacerbations in pulmonary disease, death. As before, it's optional. Responses cannot be identified by FIP and will not be shared. We have less than 45 seconds now because time had started counting. Results will be out in a minute. In a few seconds. So influenza can trigger. This is the result. 81% have got the correct answer, cause exacerbations in pulmonary disease, which can also then cause other things. 47% said acute myocardial infarction, 39% said death, 22% stroke. But it can trigger, at the outset, exacerbations in pulmonary disease. Next question. Third question is up. Influenza vaccines are highly effective at reducing the risk of influenza and its complications. We strongly agree, disagree, or strongly disagree. Neither agree Okay. Professor Cohen's presentation, I believe we can all strongly agree that influenza vaccines are highly effective. Results will be here. %, strongly agree, and that's the correct answer. 29% agree. 1% each neither agree nor disagree, and disagree. Nobody strongly disagrees. The next question, the last question in this poll. As a healthcare professional, have you been vaccinated against the flu? Yes, no, or prefer not to say. As before, these questions are optional. Your responses cannot be identified by FIP and will not be shared. But I believe that they are good questions to help us to raise our own awareness and then reflect on the presentation that we have heard this morning from Professor Cohen. So where do most of us fall? Have we been vaccinated or not against the flu vaccine? Results over here in a few seconds. In case you came in late and you prefer to listen in French, you know that there's a French translation that you can log into. As a healthcare professional, 48% have been vaccinated against the flu, 44% no, 8% can't say. Well, slightly good, but from this presentation, it looks like more of us should go and get the vaccination because we really do need it. And it will help us, protect us against these very present future pandemics that we're being warned against. Also, thank you very much, everybody, for participating in the polls. And I believe it will help us to reflect on our state of preparedness for influenza. So our next presentation will be taken by Mr. Gonzalo Pinto on the role of pharmacists in increasing influenza vaccination coverage. Mr. Pinto is the lead for practice development and transformation in FIP, and we're very happy to have you take this next presentation. Over to you, Mr. Gonzalo.
Thank you very much, Dr. Joda, for the kind introduction, and thank you to my colleagues for the opportunity to present some reflections and data on the role of pharmacists, the role that pharmacists can play in increasing vaccination coverage in general, and particularly for influenza. May I have the next slide, please? Thank you very much. First of all, I'd like to congratulate Professor Cohen for the brilliant presentation before. It was incredibly informative and an excellent summary that sets the basis for this webinar as a whole. So based as a follow-up on that, I would like to reflect on how pharmacists around the world, and particularly in the African region, can contribute to improving not only vaccination coverage, but also awareness about the risks involved in some of the vaccine preventable diseases, and particularly influenza, and especially addressing the risks that people in special risk groups, such as the older adults and people with underlying conditions, pregnant women, healthcare workers, need to be aware of. Not only the risks involved in not being vaccinated and the complications that might happen, but also the benefits that they can gain from being vaccinated, including functional ability, healthy lives, productivity, and generally remaining healthy. So really expanding and like diversifying vaccination pathways, especially for adults, is a global imperative. We all know that for children, vaccination rates are generally quite high around the world, even in countries that have problems of access to vaccines. Normally, vaccination rates for children are quite high, but we don't have the same situation for older adults. And we know that vaccines are an effective way of preventing ill health and preventing these diseases in across all ages, and especially for older adults and people who may be most vulnerable to some diseases, including influenza, pneumococcal disease, shingles, or COVID-19, for example. So we do need to employ a cross-life or a life course approach to vaccination, and so that, because it's out of an ethical principle of equity, that we cannot have targets for vaccination coverage rates that are lower for older adults, for example, than we have for children. So that's something that we need to look into. It's also an imperative to expand and build on the infrastructure that we already have. So really leverage the role that pharmacists can play in improving accessibility to vaccination services. So it's an infrastructure and a workforce that is there and that can really contribute to diversifying and broadening the avenues that people can use to be vaccinated, and especially for adults in our communities. But also, as Professor Cohen discussed before, we're just emerging from a pandemic, but we have had other pandemics before, and we will have other pandemics in the future, including influenza pandemics. So it is an imperative for our countries to have the means for a rapid response, for being ready for mass immunization in case of a new pandemic. So we really need to diversify the places, the vaccination points, and the providers of vaccination across healthcare professionals, including, of course, general practitioners and medical doctors, nurses, and pharmacists. Next slide, please. So why should we leverage community pharmacies and community pharmacy workforce in general? As I was saying, pharmacies provide an optimal infrastructure, and the pathway is already there. So it's a matter of leveraging, not needing to create a new infrastructure for delivering vaccination services to the community. And we have highly skilled healthcare professionals that in some countries, pharmacists already receive education and training on vaccination services in their undergraduate education. In some other places they don't, but they need an upskill that can be easily and quickly completed in order to be able to deliver these services, because the concepts of immunology and pathology are there as part of our undergraduate training. And we understand, for example, what adverse reactions might be to a vaccine and how to manage them. So then also pharmacies are highly accessible, and in many countries there's a very close and network of community pharmacies that have long opening hours. This is an important point because it is a preventative intervention. It's important that it is convenient to people to go and get vaccinated, because when we have very difficult access or convoluted vaccination pathways, people just won't bother, let's say, to get vaccinated. So it's important to act on convenience as well. So in fact, the pharmacies have excellent logistics and cold chain management, and they have the spatial requirements, for the delivery of these services, or can adapt the pharmacy to provide not only vaccination, but other primary healthcare services and pharmaceutical care. So allowing pharmacy vaccination, it improves efficiency and increases vaccination rates. And you'll see that there's a reference there, and I'll be showing a slide in a couple of minutes that has several references to studies that have precisely demonstrated that pharmacists contribute to increasing vaccination rates for influenza and other vaccines. And this contributes to the efficiency of overall health systems by reducing hospitalizations, by reducing the visits to primary care professionals for vaccination, etc. Next slide. Also, pharmacists are able to identify these high-risk patients that come to the pharmacy, and we see, oh, this is a patient that has diabetes, this is a patient that has a cardiovascular disease, for example, or a chronic respiratory disease, or a person that is an older patient, for example, that has, and so by the patient profile, by the medication they come to pick at the pharmacy, we can identify those people that belong to special risk groups for influenza, and we can use those opportunities to raise their awareness about the risks involved in not being vaccinated and to promote vaccination, and when authorized, also to administer the vaccine to them. And pharmacists are generally, they enjoy the trust of the public. And the countries that have introduced pharmacy-based vaccination, we've seen that the public is very enthusiastic about this service and really enjoys the convenience and the opportunity to be vaccinated at a pharmacy. The service is also in all countries that have introduced pharmacy-based vaccination. The service is highly regulated and defined in nationally adopted guidelines and standards. So it's a service that is provided to high standards of quality and safety. And it improves access to healthcare in rural or medically underserved areas when we have pharmacies vaccinating as well. So pharmacies are also increasingly gateways to care with the provision of a variety of primary healthcare services, and vaccination and other prevention interventions are among them. So these are several reasons why why it makes so much sense to involve community pharmacies in vaccination strategies. Next slide, please. So these are the references I was referring to. I won't bother you to read, but there's just to highlight that there is a wealth of studies and evidence of the impact of pharmacists in vaccination coverage. Next slide. In 2020, FIP conducted a survey of our member organizations that included data from 99 countries. And at that time, we identified a survey on the involvement of pharmacists in vaccination services. And we identified that there were 36 countries at that time that had pharmacy-based vaccination. And this, unfortunately, only included 5 countries in Africa. But since 2020, and especially because of the pandemic, we've also seen that a number of other countries have introduced pharmacy-based vaccination, and particularly from that list on the right, I'd like to highlight Algeria and Tunisia that have introduced pharmacy-based vaccination in the meantime. We knew that in 2020, Egypt was considering introducing regulations for pharmacy-based vaccination. So I look forward to Wael's presentation to learn how that is developing in the country. Next slide, please. So just to conclude my presentation, to bring to you some of the resources you may consult and use produced by FIP to support the role of pharmacists on vaccination. We have a microsite that you have the URL there for, so it's prevention.fip.org/vaccination, and there you can have access to all our publications, the recordings of other digital events we've had, our partnerships in this area, and also our Transforming Vaccination program that is there. Next slide. And just a few examples of some of the publications we've issued. Some of them are more technical, professional resources like the handbook, vaccination handbook for pharmacists, and also a publication that focuses on building vaccine confidence, and that's a huge and important role that pharmacists can have. And also a more recent publication, which is the knowledge and skills for pharmacists to deliver vaccination roles. And in the next slide, I'll show 3 final presentations. One of them is the study that I was just referring to from 2020, an overview of pharmacists' impact on vaccination around the world. Another report from this year regional challenges and enablers to leveraging pharmacists as vaccinators that focuses particularly on the regulatory barriers for pharmacists to vaccinate. And there's, of course, a section on Africa, and one that we will be launching next week. So you're the first people to know about this publication, which is about the role of pharmacists in optimizing vaccination coverage through the co-administration of influenza and COVID-19 vaccinations, which is in line with WHO's recommendations that the co-administration of the two vaccines can actually drive uptake for both diseases and optimize convenience. So we believe that pharmacists have a clear role there as well. And this is the end of my presentation. Thank you so much for listening.
Thank you so much, Gonzalo. Thank you very much for a very interesting presentation. Gives a good overview of pharmacists' roles in immunization, which is long overdue, I beg to say right now. Please, just a quick reminder that if you have questions, please put them on the Q&A box. We will not be taking questions at the end of today. Put them in the Q&A box, and the relevant speaker will attend to the questions right there in the Q&A box. So thank you very much for being part of this presentation. We have 220 people right now in attendance, and that's excellent. Going on to the next slide, please. Our next speaker for today is Dr. Wael Ali from Egypt, and is presenting one of the first of the three country cases that we'll be talking about here today from Egypt on pharmacists' roles in prevention, vaccination, and digital solutions for influenza. Dr. Ali is the president of the Egyptian Organization of Pharmacy, EOP. He's also the general secretary of the EMRO Farm Forum, a regional forum of the International Pharmaceutical Federation. You're very welcome, Dr. Ali. You can take it from here. Sorry,
thank you so much, our moderator today. Thank you so much, our moderator
Dr.
today.
Ali,
thank you so much, my colleagues.
1 minute.
Yeah,
one minute. As you speak, please remember that we have a live interpreter. So please speak slowly or calmly so that he can do a good job interpreting for the French speakers. Thank you very much. You have 10 minutes.
Absolutely.
Thank you.
Thank you so much. All right. Thank you so much, our moderator. Thank you so much for my colleagues for attending today this very important, I guess, presentation regarding to our case study in Egypt. I'm Dr. Wael Ali, president of Egyptian Organization of Pharmacy and general secretary of EMRO Farm in EMRO region. Next, please. Basically, when I'm talking about the case study in Egypt, you have to know it's a huge population here in Egypt. We are almost like 110 millions, and the Egyptian pharmacists play a fundamental role in both private and governmental healthcare. I mean, we have here systems, I guess this is a lot of people like us. We have like a private in the community pharmacy and the pharmacies, and also in the governmental stuff like a hospital, like healthcare system. Next, please. If we are talking about the Egyptian pharmacists, we are 300,000 licensed pharmacists here in Egypt. We have more than 75,000 community pharmacies. You will find each 100 meter, you will find community pharmacy. All over the Egyptian area, it's almost like 1 million kilometers. That means what? That means, next please, this huge number of community pharmacists and as well the licensed pharmacists make pharmacists role vital in the healthcare sector, and especially in prevention and vaccination for influenza. Here in Egypt, when you listen about influenza, you know, this is coming of only like a seasonal influenza? No way. Next, please. The story is starting from 2006. You know, Egypt, it's kind of like a center of the world, and we have a lot of like immigrant birds here or there. In that time, we will find, next please, something called avian influenza. In that time, what happened is it's H5N1 cases. A lot of cases, starting from like 1,000 of the birds dead. We don't know what happened already in that time. It was like a panic. Even influenza, finally, we found it called bird flu in that time. You know, this is like infectious viral diseases, like a seasonal stuff, but this kind, it's like a H5N1 virus. It's like a serious infection starting from the bird. I remember that time, the avian influenza, yes, it's occasionally infected human, but next, please. But in that time, we were like, stay waiting. This is from bird to bird to bird. What happened? It's infected the human or not? It's, it's kind of like a news each day. Finally, we find, or unfortunately, yes, human began, like a human infection from the avian infection. This time, next, please. I believe the pharmacist rule play fundamental role to prevent any sudden avian infection again. And this is a very important issue because, yes, it's starting from 2006, but right now, you'll find that's very rare to do like avian or sudden avian infection from the H5N1. That's why I believe the public health awareness rule, what's happened already in the government or even in the community staff and the pharmacists, even in the governmental staff and the private staff play a very good role because we are starting to make like awareness for the people. Please, if you will find like a bird dead, you have to make like isolation of this area. Please don't touch this bird, please. It's kind of like here, the public health rule of the pharmacist playing very important role in avian influenza, almost vaccination and awareness, starting vaccination also in that time. Next, please. So this is a story of the avian influenza. We are talking right now on the another part of influenza. It's a seasonal influenza. All of us know what the meaning of seasonal influenza, but I'm talking next, please. Right now in Egypt, influenza season defined as beginning in July, and then the peak, it will be on making December, the influenza activity peak, especially, this is like a winter time, school time. So it's kind of like a more easy to get infection during this time. Next, please. So as seasonal influenza, as you know, it's H1N1, H3N2, influenza A viruses circulated in the people viruses. In the people seasonal influenza viruses. The government, it's play next, please. Egyptian Health Ministry play a very good role in that time. Each year, the spokesman of the Ministry of the Health said in the statement, like vaccination, it's very important, especially for the elderly, pregnant women, and young children, and any weak immune system patients. That's make the things is doing better. And the good thing is, next, please, the governmental hospital is working in the government, like a Ministry of Health hospital, make a very big role in that time. Because, in that time, the influenza vaccination during this peak of time inside the governmental hospital, anyone can get it for free, especially the elderly people, as I said, the woman, the pregnant woman, asthmatic patients, any weak problem, immunity problem patients. Next, please. This is in the governmental staff. And as you know, the infection, even in Egypt and even over the world, is starting from the 6 months, not 6 years or even 6 years. If it's like a 6 months, it will get infection as a seasonal influenza. The good rule of the Ministry of Health and the pharmacists and the government, they did like let's say like a standardization of the fixed dose of this vaccination. It's become 0.5 ml full dose regardless of the age or number of doses, so it will be 5 ml. Next, please. So Next, please, again. Yeah. So the Ministry of Health make it like a free for the citizen, seasonal influenza vaccination, and they, the studies said that it's become efficiency in preventing a disease 50 to 60%, and even to prevent the severe infection about 90%. The pharmacists encourage the people, the elderly, young, and others. The pharmacists, when I will say pharmacists in Egypt, I mean in the community pharmacy, as I said, 75,000 community pharmacy. You will find like spots on each 100 meter in Egypt. So the people, they are talking with the people, you have to take vaccination, flu, you have to go to the hospital if you have any kind, especially after COVID-19 and what's happened already. Next, please. The most popular vaccination, and it's a very good thing, if you will go like have a problem, you will go to the government, you will take it for free. And if you will come to our community pharmacy, it will be only $9, only $9. It will be like a 180 Egyptian pounds. So it's available and it's affordable for 1 year. Next, please. The Egyptian, I believe, the Egyptian pharmacist is a focal point to prevent influenza in Egypt in both governmental and community pharmacy private sector. Thank you so much, and see you then. Appreciate it.
Thank you very much, Dr. Ali. Dr. Ali, for your presentation. It's an eye-opener on what is happening in Egypt and the role of pharmacists in promoting vaccination in Egypt. Thank you very much for your presentation. Next slide, please.
You're welcome.
So we're going to the next country case from Algeria. We have Mr. Redouani Soumi, pharmacist roles in prevention, vaccination, and digital solutions for influenza. Here is Redouani is the Vice President of International Relations of the Algerian Pharmaceutical Federation, or more correctly called the Fédération Algérienne de Pharmacie. So,
exactly.
Redouani, we are up for the next 10 minutes. Please, as I told Dr. Ali, please speak slowly and calmly so that the interpreter can do a good job. Thank you very much.
Thank you, Mr. Chairman. Actually, it's correct. So it's La Fédération Algérienne de Pharmacie. So first of all, thank you very much for the opportunity. So thank you to the International Pharmaceutical Federation to give us the opportunity to share the perspective of Algeria in the role and prevention of vaccination for the influenza. So just to remind the colleagues that there is a translation in French. So I know that there is a French community from North Africa. So please use the French channel if you'd like to listen to the translation. Next, please. So I think Professor Cohen made a great presentation, the clinical part of the influenza, but just to give to remind the audience that the influenza is a major cause of morbidity and mortality in the world. More than in the United States, more than 200,000 hospitalization and 20,000 deaths each year can be attributed to the influenza. So immunization is a key element in the prevention of influenza. However, adult immunization rates for influenza are well below health people target that WHO established. So in Algeria, the situation is similar about what's going on around across the world, and several strategies have been explored to help and improve the immunization rates against influenza. So as a Algerian Federation, we are exploring the strategy allowing the farm immunization. And I think as our colleague Wael presented for the Egypt case, where the avian was the wake-up call. So for the Algerian decision makers, it was the For the Algerian decision makers, it was the COVID-19. It was the COVID-19 a pandemic that allowed us to have the to start having the vaccination at the community pharmacy level. So the pharmacists are playing a critical role for the influenza and by advocating vaccine hesitancy, because the community is still, the patients are hesitating to take the vaccination, and administrating also the influenza vaccine. This is since the last year, and also providing, you know, advices and consultancy to the patients against the against the use of antibiotics, and indirectly so contributing to the antimicrobial resistance. Next, please. So we are playing as an organization again a key role within the pharmacists at the community level and with the different partners. So whether it's syndicate or the order or the authorities, in order to help the pharmacists to play a key role at the pharmacy level. So the pharmacists are advocating for influenza vaccine and doing awareness for vaccine hesitancy. So they are also administrating the vaccine. It was not the case, as I said, until the last year. So which was a really good achievement and a big achievement for the pharmacy community in Algeria. So also, and the pharmacists are educating the patients and the public on the to protect themselves against the influenza. And we as a pharmacist serve as a trusted, you know, source and information as a healthcare professional to the patients. Next, please. So in the past years for the influenza, the pharmacists were providing the vaccination, but just, you know, dispensing the vaccination and not administrating it, because from regulation point of view, we were not able to do it. And starting again from COVID pandemic, it was a good opportunity to advocate within the governments, and they now extend the administration of vaccination at the pharmacist level. So pharmacists are now playing a key role. So whether for COVID vaccination or influenza, and many community pharmacists across the country are influenza vaccination points, which ease access and increase vaccination coverage. Next, please. So of course there is, you know, limitation that we after 1 year that we are considering. First, there is a hesitation at also the level of the pharmacist, where there is many reasons. First is well, not maybe some of them are not confident about administrating the vaccination. So there is a fear about vaccinating some category of patients as there is a risk. And also we have in mind now the hesitation about the COVID-19 vaccination, whether from the patients or from the pharmacist, who is not also helping us to increase the rate of vaccination of influenza. Moreover, there is also a need to incorporate vaccine administration in the curriculum of the pharmacist, and we are having a discussion with the Minister of the Higher Education and the faculties of pharmacists to introduce certificate, at least at the first stage, for the graduated pharmacists, where they, in order to operate or upscale their skills in terms of vaccination, and then it will be extended at the curriculum of the pharmacy at the graduation level. So I think in next, so in terms of, I mean, to sum up, this is just to say that you are playing a key role, because the problem that we're facing, and maybe it's global problem, but in Algeria mainly, when there is influenza, so people are directly going and requesting, having auto-medication and requesting from pharmacists antibiotics, and the pharmacists are providing this advice to the patients to take the vaccination rather than get treated by the antibiotics, because there is the decrease of the resistance of antibiotics. So we, as a pharmacist, I think it's a double objective where we'd like to increase the rate of the vaccination, in parallel decrease the antimicrobial resistance. So to sum up, I think in Algeria, the pandemic of COVID-19 has taught us harsh lessons about the impact of health and social inequities, and we should not forget how fragile our societies can be. So the equitable distribution of vaccines, for whether it's for influenza or for COVID, is not only a public health challenge, but also it's a solidarity test for policy and decision makers, guaranteeing equal access to vaccine regardless prevention within countries. But it requires a strong political commitment and also a commitment from the pharmacists. But because the day that we were granted to do the vaccination, we saw that there is a lot of challenges, things at our level as a pharmacist. We are requiring more services to be provided at our level, but when it's done, so we see that there is some resistance, some other limits. So this is why we have a lot to do at our level, and for better access then to and prevention service at the community level. Thank you, everyone, and back to you, Mr. President.
Thank you so very much, Ridwan, for your presentation. You highlighted two very important issues: policy backing the involvement of pharmacists in immunization services, which is very important because it has to be on legal backing, as well as the twin effect of abuse of antibiotics, because people are trying to self-medicate against these viral infections. Thank you very much for your presentation, very enlightening. We'll move on to our last speaker for today. She'll be talking from a perspective from South Africa on prevention, vaccination, and digital solutions for influenza and pharmacist roles. We have Ms. Marilyn Steenkamp. She's General Manager, Sanofi Vaccine South Africa, and we thank Sanofi again for sponsoring this event. Over to you, Marilyn. You have 10 minutes, and please speak calmly and slowly so that our interpreter can do a good job. Over to you.
Thank you very much, Dr. Joda, and it's a great privilege to be speaking about this particular topic. I think it's a very important topic as we move post the pandemic, and how we manage pandemics and manage preventable diseases. Next slide, please. Okay, so I'm going to briefly recap on some epidemiology in South Africa, the role of a pharmacist, and paying attention to flu coverage rates in South Africa, and some examples of what we've implemented in the Southern Hemisphere of South Africa. Next slide, please. Next slide. Okay, so this slide is just giving you a summary of what South Africa looked like in pre-pandemic period. And what we can see here is the general trend that even herself, Prof. Cohen, called out, was a generalized trend around the winter months of having the higher prevalence of influenza. Next slide, please. This slide quickly on the right-hand side gives you a snapshot of 2020 in the middle of the pandemic, and where we see an interruption in the generalized pattern of 2019 and previous years. And these trends and shift in patterns is really due to the intervention that we've used with pharmaceutical interventions, and how this gave us protection. But you'll see in the outer slides on how this has shifted, if anything. Next slide, please. Okay, this is a look at the 2021 flu season, and you'll see here a very, very different pattern to what I showed you in 2019, and a different pattern to what we saw in 2020. And really the summary that I want to give you here is that we sit in a very different space and a very unpredictable space as we move post-pandemic. Next slide, please. So this becomes really important, and we'll see the shifts over the various flu seasons and evolutions of pre-pandemic, post-pandemic, but a real call to action from the NICD in South Africa and other bodies, stressing the importance of being vaccinated and the unpredictability of the flu season. So to use all opportunities to vaccinate and to remind patients that it's never too late to vaccinate. And what we see a general trend of the flu virus circulating throughout and no more limited to what we once understood it to be over the winter periods. Therefore, a strong call to action to vaccinate throughout the year. Next slide, please. So the first few slides was really to give you a pattern of the trends of influenza that we've experienced in South Africa over time. My next few slides are just going to cover, in terms of South Africa and the role of the pharmacists that we see becoming much stronger and much more influential just in the vaccination space and not really specific to influenza. Next slide, please. Okay, this is a really powerful slide. It has some really critical pieces of information there, where they speak about the pharmacist being a really trusted healthcare professional. And you'll see in the little graph or circular graph at the bottom, it calls out multitude of countries across the world. And it shows us the strong alliance that patients have with the pharmacist and how they trust the pharmacist. In South Africa today, the pharmacist is within the top 5 most highly trusted healthcare professionals in South Africa, and a general similar trend to what you see happening across the world. And this is a really significant data set that shows us that as we become more trusted in this space and are trusted as healthcare professionals, as pharmacists, we have a really strong mandate to support and influence patients. Next slide, please. Here, what you see is that in South Africa, we have started the program around pharmacy-based immunization, where pharmacists are accelerating in their skill set of becoming, vaccinators in South Africa. We have launched a program. It's also endorsed by the Pharmacy Council of South Africa. So a program that is started, but certainly requires a lot more pharmacists to register to expand the program. And I think this is a great opportunity for us as healthcare professionals to expand the community of vaccinators so that we actually live up to the mandate of increasing vaccine coverage in South Africa. And I'm very happy to see that the similar trend is happening in the rest of Africa, and a really good moment for us to improve vaccine coverage rates across Africa. Next slide, please. So this slide really just refers to influenza specifically and what has happened in South Africa around the co-administration piece. And we do know this was a hurdle during the influenza season, during the pandemic, but there are clear guidelines in South Africa that co-administration is acceptable, and that we have a role as pharmacists to drive co-administration of influenza and potential COVID vaccines. So here again, the mandate is clear, use all influenza. Next slide, please. Okay, so this slide is just some examples of how the South African population in pharmacy has tried and is consistently working on reaching the patient. And it really is about online booking systems for influenza, in pharmacy, advertising, digital screens, also operating in the direct patient space of social media, display ads, getting highly skilled people in these spaces to help drive awareness to patients. But I think the key here becomes very important is to having a conversation with the patient. And in pharmacy today is where the patient sits. So the mandate and the responsibility and the ability to reach this wide network of patients really sits in these pharmacies that we operate in. So a large potential to engage the patient and to have the conversation around the importance of vaccination and to bring in the topics that Professor Cohen spoke about in terms of the high-risk population and the importance of vaccination. Next slide, please. Okay, you can move to the next slide. Thanks. Okay, so this slide really speaks about vaccination and what is it that we can do as pharmacists in South Africa and in Africa to drive vaccination. And really my tire is here, do not miss any opportunity to vaccinate. So, some of the key learnings that we have is to have vaccines in stock. If you don't have a vaccine in stock, it's a missed patient and a missed opportunity. The importance of screening, but not just the patient, you have the potential to screen the entire family. When a mom walks in, are we having the conversations about the extended family with the mom? Pregnant women, we spoke about the high-risk population and the protection of the unborn baby. Also a great opportunity for us to be vaccinating against influenza. The high-risk population, again, the perceived misconception that high-risk patients should not vaccinate. How are we engaging that space? And yeah, I think also importantly is offering them the option of being vaccinated. Next slide, please. In terms of vaccination, I think I spoke about it earlier, the conversation with the patient becomes really, really important. If we are asking people about vaccination, chances there's a lower probability they would opt into vaccination, as opposed to the conversation around recommendation of vaccines and recommendation of vaccines on risk benefits and high-risk populations. So I think we need to shift the conversation from being a reactive conversation to a proactive conversation, because this will drive confidence in vaccines and vaccine confidence and move us away from the hesitancy that we've also seen develop during the pandemic. So a very important piece of the conversation to drive overall vaccine coverage, especially for flu, if we reflect on the inconsistencies that we've seen in the epidemiology pattern. Next slide, please. Okay, this is my last slide, and really the take-home message here is we should never underestimate the burden of influenza. The data is there, the data is very clear. We need to empower ourselves as pharmacists around the knowledge of the epidemiology, the importance, the high risk. So education becomes really important in the space of vaccination of influenza or general vaccines for routine immunization additionally. And yeah, I really want to endorse you and support you and say it's a great opportunity for us overall as healthcare professionals to make a shift and drive a strong mandate to improve vaccine coverage across the world. Thank you very much.
Thank you so very much, Marilyn, for your presentation. Excellent presentation. And I know that quite a number of people will be using some of the tools and the documentation that you shared in this presentation to guide some of the policy developments in our various countries, because some countries just made a pronouncement that pharmacists are now allowed to participate in COVID vaccination, for instance, without providing the policy to support that. So thank you very much for putting a very interesting slide together that would serve as a template for many others. Thank you very much. Back to everybody, we have 234 participants on this call. That's very impressive attendance for this session. I believe that we're having a very good time learning about influenza vaccination and being exposed or being made aware more of our roles as pharmacists in immunization generally across our continent. And I want to implore us, as Marilyn has said, that we as healthcare providers ourselves, we should vaccinate ourselves now that we know that it's something that is highly beneficial to protect us as well as the future in case there's an influenza pandemic. So I continue to implore all of us to use the question and answer tool for our questions so that they will be answered at that point. We would be moving on right now to the second poll. We can open the poll. You can go ahead. So for all of us to answer, I find this webinar useful for my area of practice. You either strongly agree, neither agree nor disagree, or strongly disagree. As usual, for each question, we'll have 45 seconds before the poll closes. I think we've had a very good time in this digital event. Looking forward to going to events. Looking forward to going to the FIP website to get access to the material once the event is over. So the result of our poll now. Strongly agree, 70%, excellent result. 26% agree. So overall, we have 96% of the participants on this poll that agreed to participate in the poll, agreeing to an extent to finding this webinar useful for their area of practice. 2% neither agree nor disagree, and 1% each disagree or strongly disagree. Next poll, please. Next question. So the next question, just like was asked in the webinar in June, what would they like to learn about in future webinars for the improvement of medical therapeutic knowledge? We have cardiometabolic, infectious diseases and neglected tropical diseases, MS and rare diseases, early diagnosis, multiple sclerosis, and then others. Please contact webinars at fip.org. I'll use this opportunity to say that additional topics that may not be listed here that we have, we can submit, we can send an email to webinars@fip.org and it will be collated and something will be done around it. Thank you very much for participating in the poll. And the results shows that 63% are interested in infectious diseases and neglected tropical diseases. 17% want something on cardiometabolic disorders. 15% are interested in MS and rare diseases, early diagnosis, and then others are picked. 4% were picked. Others picked 4%. 4% picked others, sorry. So for the question that people are asking, that can the slides be shared with attendees? Unfortunately, they cannot. That's the policy of FIP, which you can go to events, the events website on the FIP website and have access to the recording for your use. And there you will see all the slides that are shared within the recording. We appreciate everybody for being on this call. It has been a great time looking at the role of pharmacists across the continent of Africa in immunization. Today's specific focus was influenza vaccination, but we have other immunizations that pharmacists are currently being involved in. We're also informed that we have a mini site on the FIP website on vaccination, and you can find a lot of resources and information available at prevention.fip.org/vaccination. And this is especially good for many of us that our countries were still battling with the policy angle to pharmacists' involvement in immunization. There are a lot of resources available on that site, prevention.fip.org/vaccination, that we can use to prepare our position to support the position for pharmacists to be involved in vaccination, and to provide the legal basis, the training requirements to ensure that this happens. Another thing I would like to also say that even as many of us pharmacists are seeking to improve ourselves and to do more in our communities, we should not be discouraged by those of our colleagues that are not ready to move on. So we should just continue to move on, because people, uptake rates for change is different with different people. So we should not be discouraged by those that may not be ready to move yet. But once you find those that are ready to move with you, move on with them. And in the process of time, you'll find others joining, especially when the landscape begins to open up. So it's been a very good time here today at this event. And we'd like to thank everybody that has been on the call. We have 240 participants right now on the call, and we have a few announcements to make. There's a question asking if we can join the FIP conference virtually, and I believe that there are some sessions maybe that may be on YouTube, but generally you cannot join the FIP conference virtually. Announcements and upcoming events. Next slide, please. So we have an upcoming event on vaccines and special risk groups, older adults, on the 30th of September, 1300 hours CET. That would translate into 12 noon West African time. And we're all invited to register and attend that conference. You can snap on the QR code so that you can just quickly register for that event. Next slide, please. Still have questions, please remember that the Q&A box is where you should ideally drop your questions, and many of the questions are already being answered by relevant personnel. We also want to remind those of us that are planning to be in Seville, and those that may still be able to decide to be in Seville, that the 80th FIP World Congress of Pharmacy and Pharmaceutical Sciences is coming up 18th to 22nd of September in Seville, Spain. The FIP conference in Spain has been long coming, from 2019 to 2020, from 2020 to 2021 to 2022, and finally, we're going to be seeing ourselves physically in Seville, Spain. So we are all welcome. The Congress theme is Pharmacy United in the Recovering of Healthcare. And as we all keep telling ourselves worldwide, we're not sure of when, if ever, we'll get to the end of this COVID pandemic. It's something that seems to be here to stay, but we need to be able to recover our various practices in the health systems, in our educational systems, in political systems. Everything needs to go on despite the pandemic, and pharmacy is playing a very important role in ensuring that. So you're welcome to Seville to learn more around Pharmacy United in the Recovering of Healthcare. Next slide. Was there a seventh poll that we missed? Was there another question? Can we quickly take that? Let's quickly take that. There's another poll. So the seventh question, sorry for skipping that. The seventh question in our poll will be, what would you like to learn about in future webinars for the improvement of pharmaceutical service delivery? We had looked at some other question 6 was on topics that we wanted to take. And now for pharmaceutical service delivery, we have options including medication safety, medication adherence, digital applications for pharmacy practice, innovative pharmaceutical care plans. And then of course, again, if you have others, please feel free to submit your responses to webinars at fip.org. So we have taken the poll and the responses show that responses show that 38% are looking at innovative pharmaceutical care plans for improvement of pharmaceutical service delivery. 33% want something around digital applications for pharmacy practice. Medication safety was picked by 20% of the participants. 8% want medication adherence, while 1% are going to be sending their topics of interest to webinars at fip.org. Thank you very much, everybody, for your excellent participation and involvement in this webinar today. We targeted to spend 1.5 hours, and I believe we're right on course to finish this webinar. So can we move on to our, okay? So of course, for those of us registered for FIP, we would be seeing the various program components on the FIP website. So the program topics are never waste a crisis, learnings for future preparedness, topic 1. Topic 2 is on science and evidence supporting the response to COVID-19, while topic 3 is dealing with new and extraordinary ethical challenges. So as usual, you can click on the QR code, or you can visit bill2022.fip.org for more details. Next slide, please. So as has been shared on the chat box, events.fip.org is where you need to go to check for various downloads, various recordings of FIP digital events, and there's a treasure trove of information on that microsite for you to have access to and to use in your daily practice. Next slide. So we're wrapping up and closing. Thank you very much for spending this excellent 1.5 hours with us. We are grateful for everybody that was able to make it to the call, and we look forward to having you on future digital events organized by FIP. Next slide, please. I believe this may be the last slide. Thank you, everybody, for being here. We thank Sanofi again for sponsoring this event, and we look forward to having you all on the next. Thank you.
Thank you, everyone. Bye.
Thank you, everyone. Bye-bye.